Hello and welcome to the Redox Connection, where we talk about our extraordinary, beautiful bodies and how to enhance our overall well-being. I'm Liana, holistic wellness coach, and I just love inspiring people to tap into their full potential. With us today, once again, Dr. Ray Dixon. Hello, Dr. Ray.
Hello.
And welcome to the call. As you may know, Dr. Ray Dixon is a naturopath chiropractor with 40 plus years of practice and one of the world's first redox educators. And that's why you are here, Dr. Ray. And we are so excited and happy to be listening and tapping into all your extreme knowledge on anatomy and physiology. So, Dr. Ray, I speak to people, and what comes up often, speaking about health, is the word inflammation. Now, there's a bit of confusion on what it actually is and what organs are involved and what has it got to do with wellness. So please guide us into this topic.
Absolutely. It's a fascinating topic. They all are for me. Inflammation really is, it gets expressed a lot in terms of people's disease conditions because it's involved in every disease condition. There's almost none I can think of, no matter what name you wish to put to your disorder, that doesn't include inflammation. The two main causes of a disease, all diseases, is actually inflammation and oxidative stress. So if you go into a medical textbook on pathophysiology, disease processes, you will find chapters on inflammation because it underpins many disease processes. What a lot of people don't understand though, and to get the full context, is that inflammation is actually part of your defense system. We mentioned this when we had our session on the immune system. What is the immune system? So I would encourage everyone to also watch that already posted video on the immune system, but just to revisit the part that inflammation plays as part of defense. When we talk about the immune system, we've done that already. There's 3 lines of defense: first, second, third. First line we explained was your protective barriers. Then we went into the blood or the lymphatics, and so now you're in the body proper. We talk about second line of defense. We actually mentioned fever and a few other things, but this is where inflammation resides. So the mechanism of inflammation is when there is damage. So when there is damaged cells, if you think, how does the body deal with damage? How does it repair cells? How does it detoxify cells? How does it get protective white blood cells to the area in order to remove microorganisms that might be infecting you? Well, it does that through inflammation. Inflammation causes the dilation of blood vessels in the area, so they open up, so you get more blood there. Well, what's in the blood? All the things I just said. So you're going to get, it's called emigration, migration, emigration. You're going to get a whole lot of white blood cells coming to the area through that vasodilation, which is why you get red when you're inflamed visibly. Obviously, you can't see your liver inflamed. You can feel it, but you can't see it. But if you see inflammation on your skin, it's red because there's more blood. That's coming from the red blood cells. So you get a whole lot of extra oxygen coming in. You get a whole lot of white blood cells coming in as part of the inflammatory process to try to help heal that damage. So that's the key point. Inflammation is important. It is part of a healing response. However, when you develop chronic disease processes, in other words, the body hasn't been able to fully heal, then the inflammation can become a vicious circle, and it can almost be damaging and of itself. So when it becomes control for all manner of different disease processes, we discussed many in these videos, then inflammation kind of comes back in on itself and it perpetuates pain and problems. You know, with inflammation, with that extra blood and the defense mechanisms, also comes swelling. So with inflammation, you get what's called exudate. The technical term is exudate, which is fluids moving out into the interstitial space around cells. So you swell. Look at a pimple. Is it swollen? Is it red? So even visibly, if you just look visibly at something inflamed, you'll see the redness from the inflammation. You'll see swelling, either from serous exudate, which is clear, or purulent exudate, which is pus. We've all seen pus in a pimple. That's a purulent exudate, a lot of dead white blood cells from the battle dealing with infection. So, and then with the inflammation, of course, you get the attempt of the body to heal. But when it's not able to heal, as I said 3 or 4 times already, it becomes kind of a vicious cycle. In many respects, it can help perpetuate the process. Now, pain is part of inflammation. I mean, even a pimple can be slightly painful sometimes. But of course, pain is associated with inflammation because some of the inflammatory chemicals stimulate nociceptors, which are pain receptors. So you get pain. And the swelling can cause pain because you're expanding capsules around organs, etc., and they have pain fibers. So pain's associated. And there are degrees of loss of function. In other words, the cells no longer being able to perform their normal healthy functions based on the degree of the disease process. Now remember, there's varying degrees here. You've got mild. A pimple would be considered very mild, wouldn't it? It's not life-threatening, not likely to cause trouble. But, you know, if you end up with hepatitis of the liver due to infections or whatever it may be, or cirrhosis from alcoholism or whatever, well, you know, that's obviously a very deep-seated chronic inflammatory disease process. So the degree of inflammation and the chronicity, the time, are critical in the discussion of inflammation. So the key point is inflammation is not a disease in and of itself, but it's participating in many, many disease processes.
Right, that's very, very interesting, because we do refer to it as a disease, but it's actually not. If we've seen it from how you've just explained it, it's actually it's a defense mechanism, great, and it's bringing us attention, because once we've swollen and we have pain, the way I read it is the body's actually saying, okay, slow down here, there's damage, control damage, please come in, we've got to look after and we've got to tend to something. Now my question obviously that comes after, so inflammation is not an enemy, it's an alarm going off, something's not functioning. What triggers that inflammation?
Damage. The damage to the cells can be toxins, insecticides, pesticides, heavy metals. The damage can be viruses, bacteria, fungi, mold. That's a fungi. I mean, you know, there's all kinds of challenges to cells. And then there are local chemicals released in that area, chemokines that actually trigger the messaging that goes out to the immune system to initiate the inflammatory response. And in fact, attracting white blood cells to the area to help address that damage in some cases is actually called chemotaxis. It has a name, chemotaxis. So there's a whole lot of massive amounts of signaling going on to trigger multiple layers of the immune response. I mean, inflammation is second line, but you're at the very same time triggering the third line of defense, which involves cytotoxic T lymphocytes and antibodies, for example. So they have to come to the area to help address the damage, which there are many causes for. Apart from the ones I mentioned a moment ago, what about deficiency diseases? You know, anything that causes damage to cells creates disorders or disease processes involving inflammation.
Beautiful. Okay, so as from that point now, we've understood what causes it. My next question is, how can we repair it? The body's already doing it, but what can we do to support our body heal?
Oh, well, the body's attempting to deal with it. So the body has its own inner mechanisms, which are all these defense levels, but they all rely on certain things. Oxygen, for example. Okay, they rely on nutrients. So there's up to 50 essential nutrients, be they vitamins, minerals, fatty acids, amino acids, sugars, glucose, etc. So, we've got to look at the big picture. What's our diet like? Is it providing healthy nutrients, or is it providing artificial flavourings, colourings, and varying chemicals adverse to your health? So all this is your big picture before you can narrow in on the little picture. So certainly diet, healthy diet, clean air, clean water. Now, I appreciate there's people in cities without clean air. Well, then you have to address all the other issues and try and keep the air as clean as possible in your living environment. These are all factors to consider to help deal with what is damaging to trigger your health challenges and varying disease conditions that you get. If you're smoking and insulting your lungs constantly with a massive array of toxic chemicals, can you imagine the damage that does not just to your airways, causing chronic obstructive pulmonary disease, emphysema and lung cancer, but what happens when all those toxic chemicals travel through your bloodstream? Well, now you can factor in atherosclerosis of your coronary arteries, potentially other arteries around the body, clots causing strokes and heart attacks, or clots in your legs. So the cascade of damage is extraordinary from exposure to damaging chemicals as well. And if we choose to do that freely, it's kind of a bit like playing Russian roulette, isn't it?
Right. Two things that I really love. One is that we are actually responsible. Again, it's like the body is actually one of our responsibilities with how we're nurturing it. I love the way you keep on pointing out in these series the importance of lifestyle. It's how do you put all these things together to support well-being, obviously. Now, again, the redox connection. What has redox got to do with inflammation?
Well, we've seen there's multiple levels at which the body is triggered through chemicals, through chemistry, to address challenges. We mentioned chemokines, we mentioned, there's all manner of inflammatory signaling chemicals. We've covered hormones before, we've talked about the nervous system. There's all different tiers or levels of signaling. It's a massive array, very, very interesting. And we still don't know it all, a massive, complex array of signaling that's going on to address challenges. But the deepest signaling molecules that have ever been discovered, which affect every cell in the human body, not all chemicals affect every cell in the human body, these ones do. They signal between cells, whether it's in your brain or your liver or your pancreas, that they are involved in signaling across the entire human body. They control the genome, the DNA, and the chromosomes, and that's redox signaling. So it's apart from, as a natural therapist, having focused on clean air, water, food, and nutrition for so long, those essential nutritional elements that the body needs, we now know, and this is new science, this is last 20, 30 year science, we now know that the human body beyond puberty, healthy puberty, essentially is deficient in redox signaling molecules. They're made inside the mitochondria of every cell. They're made in the trillions. They're made and perform extremely important signaling for health functions. They're made from salt water. They go back to salt water. And from peak puberty, we are on an average decline of 1% per year in making these trillions and trillions and trillions of molecules. So what does that mean? Well, it means if you're not peak puberty, and peak healthy puberty, not sick puberty, you're deficient in redox molecules. And that means the only way to get them, you can exercise more. That does not compensate for the entire range of deficiency with age, but it slows it down. So instead of you being 1% decline per year, you might be 0.8%, super fair. So there is no way to actually replenish those deficient molecules until now. And that's because a supplement has been made available moving around the world, a bio-replenishment formula, of redox signaling molecules in that blue bottle behind me for the first time in human history for the last 12 years. Before that, there was no way you could ever supplement with a bio-replenishment form of redox signaling. So they are a critical factor. All else comes.
Can you repeat that? Sorry.
They are the number one most critical factor for your health. To help the body to heal itself from anything. They're the number one most critical. Everything else comes after that.
Beautiful. And that including inflammation.
Well, they will help to manage.
Perfect. Well, there you are. Wonderful. And I'm sure we could spend some more time discussing this, and most probably we will come back to this over in the next series. But for now, just thank you once again, Dr. Ray, and to all of you, keep on following us. Leave your comments and ask for other topics that you would like to explore further. And just remember that healthy cells, healthy you, happy you. See you next time.
Bye. Bye-bye.